Good afternoon, everyone, and welcome to today's session. We're very pleased to have you join us to look at the gaps in food access during COVID-19 across our state. And I just appreciate that you've taken the time and in your Zoom weariness to join us today to learn more as well. We have a very high-level overview of GBFB's response to COVID-19, our commitment to business data and analytics, and the team that's representing business and data analytics, along with the purpose behind why we did this survey in the first place. I do want to mention that this particular work was funded through Stop and Shop, and in particular, its gifts through the Hunger to Health Collaboratory. So it enabled us to be able to fund this kind of research and to learn more about what our state looks like. We have a lot of people to thank, especially all those participants that shared their time and their experience with us so that we could learn more. I hope that you're really going to enjoy today's presentation, but before we get started with the presentation, we have a very short but important message from our friend and anti-hunger champion, Congressman Jim McGovern.
Hi, everybody. I'm Congressman Jim McGovern. You know that ending hunger is my passion. The report that you're about to see illustrates exactly why we need to end hunger and end it now. I'm so grateful and thankful to the Greater Boston Food Bank for leading the charge with this statewide gaps in food access during COVID-19 report. And a special thank you to the Hunger to Health Collaboratory and Stop and Shop for funding it. What the report found is alarming. Just between October and January, a staggering number of people here in Massachusetts were food insecure, including an even higher and disproportionate number in communities of color. And despite the uptick in food assistance, there are still gaps, and there is still stigma. This tells us that so many more are struggling than we even realize. And even more pronounced are the testimonials of those living with food insecurity every day and the challenges that they face. These testimonials humanize this data and show how important it is to bring those with lived experience to the table when we are having conversations about ending hunger. Clearly, we all have our work cut out for us. And that's one of the reasons why, as chairman of the House Rules Committee, I've begun holding a series of hearings, roundtables, site visits, and conversations about hunger. We'll be meeting here in Washington and across the country to build up support for a White House conference on hunger. Now, the last time the White House held such a conference was 52 years ago, in 1969, the same year we landed a man on the moon. I think it's long past time to get everyone together in one room again. Nonprofits, government agencies, political, faith, and business leaders, food banks, and importantly, those with lived experiences. I believe that we can elevate this issue and come up with a roadmap to a holistic nationwide plan to end hunger once and for all. I'll pound the gavel all day long on these issues. And I hope after you hear these numbers and testimonials, you'll join me in demanding action. This report will be highlighted across social media on Facebook, Twitter, and Instagram. So follow along. I look forward to utilizing this work to inform our conversations in the coming months. Thank you and be safe.
Thank you, Congressman McGovern. You are a true champion, sticking through and through all these years and continuing to ask for justice and equity for those who experience hunger. So our gratitude to you personally. Now let's move on to the presentation. It's my pleasure to introduce to you our Assistant Director of Business and Data Analytics, DJ Tattlebaum.
Thank you, Katherine. In my role at the Food Bank, I lead a team that uses available data and research to enhance our understanding of the needs of those experiencing food insecurity across the region. With the elevated need and uncertainty brought by the pandemic, it became clear that further research was necessary to better understand the characteristics, experiences, and challenges of those receiving food assistance, many for the first time. And for those struggling with food insecurity yet not receiving any food assistance, what are the barriers preventing them from getting the help that they need? As Katherine noted, this important research was conducted by our data team, and there were many collaborators in the process. Today, you will hear from our lead researcher, Dr. Rachel Zack, epidemiologist and senior data analyst at the food bank, and Dr. Lauren Fiechtner, pediatrician at MassGeneral Hospital for Children and senior health and research advisor to the food bank. You will also hear our recommendations for some next steps from VP of Community Impact, Jonathan Tatro, and Senior Director of Public Affairs, Katherine Lin. After our presentation, we will hold the Q&A, so please submit questions throughout the presentation using the Q&A function or utilizing the chat. Now it is my pleasure to introduce Dr. Rachel Zack to begin the presentation.
Thank you, DJ. To begin, I'd like to provide you with some background on this report and what we did. As GBFB wanted to better understand food insecurity, food assistance use, and barriers to use during the pandemic, we conducted a statewide survey throughout Massachusetts. I think it's important to keep in mind that this survey was done at one point in time, this past fall and early winter, from October 2020 to early January 2021, when food insecurity was likely at its peak in the state. We designed and carried out an online survey of 3,000 adults living in Massachusetts. This is the first statewide survey that GBFB has conducted, and the first time that we have surveyed the general population and not just those receiving food from our programs and partner food pantries. We really wanted to hear from people who were food insecure, but not using food assistance in order to better understand barriers to use, so we oversampled low-income adults. We then used statistical methods to make our findings representative of the Massachusetts population. The goals of this survey were to identify the prevalence of food insecurity in Massachusetts, to identify gaps and disparities in food assistance use in Massachusetts, and to develop data-driven recommendations to ensure that all have adequate access to food in our state. We conducted this research as part of the National Food Access and COVID Research Team, known as NFACT. This is a group of researchers that came together at the beginning of the pandemic, and research is being conducted in 15 states. Most of the work is being done by academic researchers. There are only 2 states where the work is being conducted by non-academics. One is the work that we're doing in Massachusetts, and the other is being led by the recently merged food banks in Connecticut, Food Share and the Food Bank of Connecticut. Next, we will review some of the key findings that have come out of our research. We all know that food insecurity is on the rise due to the pandemic. With our survey data, we were able to actually quantify how food insecurity has increased during the pandemic. We measured food insecurity using the 6-item USDA Household Food Security Survey module. And I want to mention that we collected data only at one point in time, which was during the pandemic. So the pre-pandemic data were collected retrospectively by asking people to recall their experiences in the 12 months before COVID. As shown in the top of this bar graph, we found that food insecurity increased from 19%, shown in the pink bar before the pandemic, to 30%, shown in the red bar during the pandemic. This is a 55% increase in food insecurity. As we dug into the data, we saw that there were large disparities in who was experiencing food insecurity. Black and Latinx adults were approximately twice as likely as white adults to be experiencing food insecurity, both before and during the pandemic. Additionally, households with children were approximately twice as likely as households without children to be experiencing food insecurity. We knew that these disparities existed, but this data demonstrates in more detail what we've been seeing on the ground. Some of you may be aware of the food insecurity estimates and projections that Feeding America released in late March. So I'd like to quickly share Feeding America's findings and compare our results to theirs. In this figure on the left, our data is in blue and Feeding America's is in orange. All of these estimates are for the state of Massachusetts. You can see that our food insecurity estimates are 2 to 2.5 times higher than Feeding America's. However, what is similar is that we both find approximately 50% increase in food insecurity during the pandemic, and both studies find stark racial and ethnic disparities in who is facing food insecurity. So why are these estimates different? The differences in the estimates are due to methodological differences between the studies. And the true prevalence of food insecurity is likely somewhere between Feeding America's estimate and our estimate. Feeding America gets their data from the Current Population Survey, which is a phone survey conducted by the US Census Bureau. People receive a phone call and are asked potentially sensitive questions on food insecurity. In contrast, the GBFB data are collected via an anonymous online survey. We hypothesize that those who respond by phone may be less likely to respond affirmatively to questions on food insecurity. Another potential reason for the different findings is that GBFB data come from direct measures of food insecurity during the pandemic, whereas Feeding America's 2019 estimates come from actual survey data, but their 2020 numbers are projections based on 2019 survey data combined with unemployment rates and poverty rates during the pandemic. So what they do is they project food insecurity during the pandemic based on their assumptions on the effect of annual unemployment and poverty rates on food insecurity. In addition to the quantitative data, we also collected quotes from study participants via our online survey. These quotes have been helpful to give the data a human aspect, and we'll be sharing more quotes throughout this presentation. As I mentioned earlier, we have representation of people living throughout the state, so we're really able to hear the voices of people from out the state. And here's a quote from a mother in Somerville that speaks to how difficult it is to experience food insecurity. She shared, "It's been very hard as a pregnant mother trying to cook healthy meals. At times I try to eat smaller meals in order to save my food, and it's sad knowing I have to feed not only myself, but my baby." On this next slide, we look at food assistance use among the food insecure. Although we found that among the food insecure, more people are using food assistance during the pandemic than before the pandemic, there are still many who are not using food assistance. We found that during the pandemic, only 32% of those experiencing food insecurity are using food pantries, only 46% experiencing food insecurity are using SNAP, and only 55% experiencing food insecurity are using either food pantries or SNAP. This quote from a single mother in Malden speaks to the importance of food assistance programs and how many people need to use multiple forms of food assistance to obtain enough food. She shared, "Food pantries and SNAP benefits have really helped my family through this pandemic, along with the extra PEBT benefits. Kids eat a lot, and I would never be able to support them and myself if I didn't have food stamps and food pantries." Next, Lauren will speak in more detail about food assistance use and describe some of the barriers to use.
Thanks, Rachel. So as Rachel mentioned, only 1 out of 3 adults experiencing food insecurity are using food pantries during the pandemic. So we looked at this data by racial ethnic group as well, and you can see that overall food pantry increased from 9% pre-pandemic to 12% during the pandemic, and that those folks who are Latinx adults increased their use of food pantries from 21% to 28%. And also Black adults increased from 20% pre-pandemic to 26% during the pandemic. Finally, households with children also increased their rates of using the food pantries from 12% pre-pandemic to 18% during the pandemic. So we really wanted to understand what the key barriers were to food pantry use. And what we found from the data was that self-reliance, stigma, and awareness were key barriers. So here you can see that 74% of adults not using food pantries wanted to support themselves instead. 62% were unsure when they were open, and 58% were embarrassed to use them. Also, 57% worried that they had too many personal assets to access a food pantry. So here's a quote from a mother in Malden. "I have been using food pantries since I was young. My mother taught me how to do it. They are very helpful when you're having a hard time. I've met people in my life who are embarrassed and think that it's only for homeless or poor people. Honestly, it's for anyone who's looking to add food to their house if they're having a hard time and can't afford to go to the grocery store." So then we looked at those who actually came to food pantries and how their experience was. So 89% felt welcome when they came to the food pantries. 89% said they'd recommend food pantries to others. And I was very pleased to see that 80% felt the food aligned with their cultural beliefs. So this is from a first-time pantry user in Worcester. I never realized food pantry supplied fresh fruits and vegetables. Now that comes in handy more than ever. And as a physician coming to work for the food bank a couple of years ago, I was surprised too at how much produce the food bank delivers to food pantries. And so I think it's something we really need to make people aware of. So as Rachel also mentioned, only 1 out of 2 adults experiencing food insecurity are enrolled in SNAP in Massachusetts. And so again, we wanted to look at who was using SNAP use and how we could better improve gaps. And so here you can see that 12 months before the COVID-19 pandemic, about 12% of adults were using SNAP, and this rose to 20%. And then you can see that Latinx adults, 27% were using SNAP prior to the pandemic, and that increased to 40%, as well as Black adults, 22% prior to the pandemic, which rose to 39%. Also, households with children, there was a rise in SNAP use from 16% to 29%. So this is a mother from Hampden County who said, along with max SNAP benefits and pandemic EBT, at least for a couple of months, we felt food secure. Without both, we still struggled toward the end of the month. We have both been out of work during the pandemic with 3 children at home. It has been a very hard year. So multiple food assistant programs are needed for folks to feel food secure, is what this quote highlights to me. So these are the key barriers to SNAP use, and what we found was that folks identified eligibility concerns, self-reliance, and stigma as their barriers to SNAP use. So you can see here that 78% worried that they were not eligible for SNAP, 73% wanted to support themselves instead, and 51% was worried about the paperwork they may need to share. Also, 46% still felt that embarrassed to use it. So a single woman with a graduate degree from Norfolk County told us this: I just feel like the cashiers might judge me for using SNAP, or my family if they found out. Now I'm going to pass the presentation over to Jonathan.
Thank you so much, Lauren. Really appreciate being able to dig into the data here and just share that so proud to be part of an organization that is making this type of research available so that we can learn more, have access to this data, but not just have data for data's sake, but to ask the question, what do we do with it? And how do we improve the services that we provide to families and individuals who are struggling with food insecurity? So as we went through the data that this research provided us with, we really bucketed the programmatic and policy recommendations that were coming out into 2 broad categories. The first is to decrease stigma around accessing food assistance of any type. And the second is to decrease inequalities in food access. And you can see some of the more detailed recommendations here. These specific anti-hunger efforts include a public awareness campaign aimed to reduce stigma and share existing resources for food and financial assistance. And again, that doesn't just include food pantries or soup kitchens. It includes SNAP, WIC, other federal and state benefits that could come alongside an individual or a family and support them financially when they're going through a hard time. We also want to continue to develop distribution methods that decrease stigma. Throughout the COVID-19 pandemic, we've seen a lot of home delivery, farmers market style, and curbside distributions increasing in prevalence. And we want to explore where appropriate to continue those and expand on the learnings that we've had there. We want to promote equitable data collection and data-informed food access investments. We recognize that data collection is a delicate balance of collecting enough information to be able to have data-driven decision-making. However, we don't want to ask so many questions and collect so much information that it becomes a barrier to those who are looking to access those services and actually becomes a deterrent so that folks are not comfortable to participate because they feel those questions are intrusive. GBFB will continue to analyze real-time data on the prevalence of food insecurity among communities of color to ensure we are closing the gaps. We've included that in our capacity grant process this year with some good success as a first effort, and we're going to continue to see where we can continue to expand our work there as well. And then lastly, enhancing community engagement with communities of color to better ameliorate food insecurity and ensure equitable food distribution. This includes amplifying voices of diverse individuals, increasing access to bilingual staff or volunteers, or written information like posters and materials that are handed out during distributions. Ensuring that all people know they are welcome and that no photo identification is needed at food pantries or soup kitchens. And then of course, training anti-hunger organization staff and volunteers on implicit bias and how to distribute food in a way that ensures dignity of those coming to those programs for support. And with that, I will turn it over to Katherine Drennan-Lin.
Thank you, Jonathan, and thank you everyone for joining this morning or this afternoon. So now we're looking at some public policy recommendations coming out of this report. And I will say just to begin that the opportunity before us to really cause and affect policy change around anti-hunger programs is before us like it has never been before us before. And, you know, as everyone has seen over the last 15 months, and particularly in the last couple of months of this new Biden-Harris administration, policies have been changing. It feels like week to week and day by day and hour by hour. So we wanted to purposely put these recommendations forward that were somewhat broad and evergreen that could help you know, put the wind beneath our policymakers and really carry us through the fall as we are working towards, you know, various COVID-19 relief packages, this federal, state budget processes, and various changes that are coming up before us. So the first one, we really are focusing on supporting those policy changes coming out of the Biden-Harris administration and really getting behind the implementation. This encompasses a lot of different areas, but wanted to make sure it was a broad support of those policy changes coming down from the federal level to the states. The second one is around specific to federal and state policies, just prioritizing funding and extending food and financial assistance policies and infrastructure investments to equitably reduce food insecurity and poverty. Policymakers in particularly should focus on the Emergency Food Assistance Program, TFAP. That is really the USDA food that is coming down through food banks, schools, and various other avenues. We've seen other programs like the Farmers to Families Food Box program over the last year, and that program is coming to an end this month, but there's been a commitment from USDA to boost the TFAP funding coming down to states. So really looking closely at that one at the moment. The next one is around SNAP. There's a lot around SNAP, particularly keeping the 15% boost to SNAP that is set to expire at the end of September. We want to continue that increase to SNAP and making sure that families that are on SNAP are continuing to get the maximum benefit of that program. And then WIC is another program we're really focused on, particularly as the federal child nutrition reauthorization comes before us. How can we improve in that program and among all of these programs? The next one really is focused on just reducing the gaps in access around reducing the administrative burden and barriers for those applying for benefits. So there's a lot that could be unpacked on this one. At the state level right now, we've had a lot of conversation about streamlining the application portal for various benefits. That's something that definitely we could pursue here at the state level, but there's a lot of other administrative pieces to making sure that it's not hard for individuals to be accessing and applying for these benefits. Two areas that we've seen have been really helpful over the last year that we'd love to see some sort of continuation of, and we are looking to policymakers to look to create a long-term funding strategy for programs like PEBT and universal school meals. Universal school meals has been something that has been talked a lot about the national level as of late, and as many of you know, tuning in, we have a legislative campaign right here in Massachusetts looking to create universal school meals for all, and thank you to our friends at Project Bread for really leading that charge. The next one is around our current budget process here in the state. We're in the middle of their FY22 budget process, and we really want to continue to prioritize food security in those budget conversations and prioritizing the Massachusetts Emergency Food Assistance Program, or MGHfC, which is about 30 million that goes out to all 4 food banks across the state and nearly 1,000 food pantries programs that are directly servicing many individuals who are food insecure here. And then prioritizing funding around the Healthy Incentives Program as well, which is another benefit that just helps boost SNAP and the ability to purchase more fruits and vegetables for those who are on SNAP. So in general, there's another piece here in terms of infrastructure, making sure that there's enough funding going towards programs to be able to implement and distribute and continue their programming. So in Massachusetts, we've seen a food infrastructure security grant program that has gone out to many organizations across the state. We'd love to see something similar to continue and invest in the infrastructure of the food system overall. And finally, we know that a lot of the programs I've mentioned are programs that are going to, serve the immediate need, but we know that there are root causes to food insecurity. Hunger is a symptom of poverty, and so policies aim to reduce poverty and the burden of unemployment will be key to ensuring equitable economic recovery. So we're looking to advance those policies to get people self-sufficient. As we've seen in this report, that was clear. People would much rather support themselves and support their families. And so we want to identify those policies that can enable them to do that. So we'll finalize. The final quote that we have in the presentation this afternoon is from a mother of 4 from Worcester. She says, "Food assistance has been enormously helpful because one of my 2 part-time jobs was eliminated because of COVID. At first, it felt strange to use, but it has made up the difference in my lost wages, and we don't have to compromise on what we feed our family. I'm enormously thankful." Now I'm going to kick it back to Dr. Rachel Zack. Thank you.
I will just end with a brief summary of our findings. We found that food insecurity has been steeply on the rise during the pandemic in Massachusetts, and people of color and families with children have been disproportionately impacted by food insecurity. Despite the increasing number of people turning to food pantries and SNAP for the first time during the pandemic, only 55% of those experiencing food insecurity were using either food pantries or SNAP. The most common barriers to using food pantries or SNAP that we found were a desire for self-reliance, a sense of stigma, lack of awareness about program availability, and concerns about program eligibility. We believe that policymakers and hunger relief organizations should strive for more equitable food assistance and promote use of state and federal programs and decrease stigma associated with food insecurity. Without continued and expanded policies to alleviate poverty, the hunger crisis will continue to plague the most disadvantaged. Thank you. We'll have a Q&A session, but if anyone has wants additional information or has questions after this presentation, you can feel free to reach out to us by email at data@gbfb.org, and you can learn more about our business and data analytics team at gbfb.org/data.
Thank you, Rachel. So we're going to open up a Q&A portion of the program. So if there are any questions, please drop them into the chat or submit them through the question and answer area. I'm going to start by a question that just came through on the Q&A. This question is from Don Cox, one of the Greater Boston Food Bank's member partner agencies. Was there any consideration given to age disparity? And Rachel, I don't know if you want to take that one. I know that we looked at some ages.
So we did look at age and how that is related to food insecurity. We don't have that in our report. We might come out with that in future papers, our reports. But what we found, which I think has been seen in other data, is that seniors tend to have a lower level of food insecurity. Highest levels of food insecurity tend to be in younger parents, but there were high levels of food insecurity throughout all ages. We did see that the barriers tended to be different depending on age. So for example, in the qualitative data where some people responded to our open-ended text questions, seniors and people with disabilities often talked about not using food pantries because it was difficult to get to the food pantry. And some people commented that they were surprised or really grateful that pantries were starting to deliver food, and then they were able to get food from a pantry due to the delivery, or because they didn't have transportation or it was difficult for them to travel. They could really only get to food pantries when they had a friend or family member who could take them to the pantry or get food and drop it off for them.
Thanks, Rachel. So the next question in the Q&A is, what tactics are suggested by this work for increasing local awareness of food programs among people who are not presently using them? So I think that this question could be unpacked in a lot of different ways. I'll start by saying, just from a communications perspective, I think there's a lot of awareness. I think that this report actually has helped bring some awareness to this issue. I will say, you know, there is no surprise that there is still stigma around these programs and access. When you look at the Globe article in the comments, which I would never suggest people to do, but when you look at that, you realize that there really still is so much misunderstanding around this issue and what people face every single day. And so I think I was on a call recently and someone had suggested, you know, a simple comment on some articles that really just directly combat some of those thinking, and just responses, I think, can go a long way. So that's just, I think, one tactic is making sure that, you know, those negative comments don't just like land out there. I think that they get responses. I think in addition, you know, we have a number of tactics or communications vehicles in terms of awareness, making sure that people know the resources. So I will drop in the chat again, but we always point people to Project Bread's food resource hotline in Massachusetts, as well as Mass 211. We have a list of all of our agencies and their contact information on our website. In fact, all the four food banks across the state have that information listed on their websites. So making sure that the resources and information are available at a high level. But I think that the recommendations in terms of local and targeted outreach are also really important. So those engagement tactics that Jonathan mentioned, and then the last thing I'll just mention is that this can't be just the anti-hunger organizations, the food banks, pantries. It has to be more of a collective effort. So that's why we specifically called out, various stakeholders and or industries. So the healthcare industry, education, school system, and retailers. We want to meet people where they are. So if they're, we realize many people come to our resources, our programs in many different ways. So making sure as many people within a community or their trusted, professionals, whether it be a teacher or a doctor, is also pointing them to the right resources. Jonathan, do you want to jump in and add anything there?
Absolutely. I would just reiterate that each of us in our personal and professional lives can be ambassadors for this information. And I think we need to be. I think we need to be carrying this message that all are welcome that need support at any of these programs into each corner of our lives, so that we can start to break down this barrier of stigma that has come across so clearly in the data here. And so in each community, that's going to look differently. And so you're going to need to sort of identify which groups are connected and have the power within a community. For some communities, it may be an interfaith group. For others, it may be a business group or a chamber of commerce meeting, or a library group or a soccer group, whatever it may be. Start to bring the dialogue about the reality of food insecurity in each of our communities, in each different type of family makeup, in each age bracket, and talk about the need for communities to come around those folks and support them. We need to normalize people getting help when they need it. And so whenever we can talk about it, that is a step in the right direction. And I'll take Katherine's comment about just responding to media articles and bring that to a personal level. When you hear somebody making a comment in person, or you have a personal connection with that individual, that's the time to invite them to go volunteer with you and to get involved and to get rid of some of those myths that they're holding on to in a very personal, interactive way. So I would encourage you to invite them, because if you invite them, they're going to be hard pressed to say no. And then when they do, they're going to learn so much about the people who we all are supporting through these efforts.
Thank you, Jonathan. So I'm going to take a question from the chat that just came through. So what are your thoughts of using the Hungerverse tool to assess and refer individuals in need? And I'm wondering if Dr. Fiechtner or Dr. Zack could take that one. I'm guessing the Hunger Vital sign, I'm sorry.
Okay. Perfect. So I'm just looking in the chat, and so I think there is a big push in the healthcare industry to start using screening, and it's really important, I think, for the healthcare industry to continue to do that. Just as an industry, we've had to really move to telehealth. So I think we're becoming really creative in how we're screening and making sure we're doing phone calls, and also making sure we're having bilingual staff do these calls and these screenings as well. But many of the things that we saw in this report surrounding stigma exist also when answering these questions. So I know the woman who screens in my clinic has had patients say, I don't feel comfortable answering these questions. And so I think, again, the public awareness campaign to really normalize getting help when you need it, and also for us as a healthcare community to say, for me as a pediatrician, almost 1 in 2 of my patients is struggling with food insecurity, and I realize that, and we can get you resources that help.
Great, thank you. And Jonathan, I'm hoping you can take this next question. So it says, what role do special diets or cultural produce play in accessing food assistance?
That's a great question. It's one that we get often here at the Greater Boston Food Bank. And that's where I look to our really robust network of partners across Eastern Massachusetts to have that local connection and that relationship with the families and individuals that they're serving. They often develop those relationships and can bring to bear sort of culturally appropriate or different foods through specific donations and other programs as they give those out. But as you look at the food that comes through all 4 of the food banks in Massachusetts, there's quite a wide variety, lots of healthy, fresh produce, a lot of staple items that can be used in many different cultural dishes. And then when you go to federal programs like SNAP that offer a great amount of client choice and ownership over what a family is bringing home from the grocery store, all of these resources together sort of dovetail to allow for very robust options for individuals and families to be able to meet their needs. So again, it is something to be aware of and to focus on. I don't know if any of the other panelists want to add to that.
I think you covered it, Jonathan. Thank you. Appreciate that. So I'm going to take the next question that just came through. How does the Greater Boston Food Bank expect the level of food insecurity to evolve after the end of the pandemic? Is this expected to be transitionary while the vaccines roll out, or will this linger for the coming years? Rachel, do you want to respond to this, or Katherine?
Sure, I can respond unless, if Katherine, did you?
Katherine.
I think you're muted.
Sorry, there you go. Sorry, let me jump in, and then I'd love to hear your data response on it, Rachel and others. A lot of researchers that work with the food bank had originally told us 2023, but now we're hearing more like 2025. And I think what the important part is, it's not going to be such a spike and a fall. We're not seeing that. We're seeing a much more, leveling may not be the right word, but it's not, it might be softening, that might be the better word, but it's not dropping. And then the other piece that we've been advised is the volatility, that you can't sort of think it's over, and that things will occur based in the economy or to a particular community, a particular age group, some situation that we will need to respond to. So all that's, we're looking to prepare till 25. And just a reminder that the recession was about 10 years to get out of from 2008. We've not seen a pandemic, let alone a global pandemic. And so we believe that we will need to be steady and vigilant, and our commitment is to continue to provide as much healthy food as possible to increase and sustain access and to make sure that communities are served to the best of our ability.
Rachel, do you want to add anything?
Yeah, I don't think I have too much to add. I would just say there's the U.S. Census Household Pulse Survey, which does throughout the nation weekly surveys on the impact of the pandemic, or the survey started during the pandemic, and they have some questions on food insufficiency. And so that survey has shown that since the new administration began, food insecurity does seem to be declining to some degree, likely due to large increase in government assistance with additional SNAP benefits, additional stimulus money. And so if all of that government money really, I think, needs to sort of continue, or we could see a steep rise in food insecurity again.
Thank you, Rachel. So the next question, were there any differences in communities that already provide free school meals to all students, such as Worcester, compared to other communities who do not? For example, did that seem to buffer the effect of increased food insecurity in those communities?
So that's a really good question. Something we haven't looked at, but I think now that that's been brought up, something that we would like to look at with our data. From looking just at the qualitative data in terms of the comments that people wrote in as survey responses, we did see that pandemic EBT, which any children who were in in a district that had free school meals, they were eligible for pandemic EBT. And many parents spoke to how helpful pandemic EBT was, that for many, it was a surprise to them. They didn't know it was coming, but they were extremely grateful. And many were also worried about what would happen once pandemic EBT ended. So that was a common sentiment that we had, grateful for the extra pandemic EBT funds, but also fear about what they would do once those funds were no longer available.
Thank you, Rachel. So next question, what other data is needed and how can colleges and universities contribute to the research that is still needed?
I can jump in here. I'd say, a way to come up with some more real-time metrics around food insecurity. We rely a lot on data that comes out of outside of research like this, data from the Census Bureau, which takes time for them to release. For example, the household food insecurity rate for last year the official metric won't come out until this September. So having that long delay really prevents us from understanding what's going on the ground. I'd say in addition to that, just more research like this, understanding who it is that's using food pantries and who it is that's not using food pantries, so that we can come up with ways of reaching those people to remove any barriers to food access.
Thank you, DJ. And I think after, I will just make a comment about the research in the report and that we presented today. There's so much more that hasn't even been shared that came through this research, and I'm sure further analysis it will be conducted. And in terms of, this month is Mental Health Awareness Month. We have a lot of information around just the impact that food insecurity has taken on the toll of mental health on so many individuals across the state. So there's just so much more to be done. And I think thinking through, we learned a lot in this report and saw that there's probably other questions that we could be answering and populations to be focusing on. So it's awesome. And related to that, there's one other question around the percentage of survey respondents who were undocumented immigrants. Rachel, take that one.
Yeah, that's also a great question that we don't have the data to answer. We did not ask survey respondents about immigration status or whether or not they were immigrants. What we did was, in terms of having the survey open to a wide variety of respondents, we had the survey available in English and Spanish. So respondents could respond in either language. The majority of the respondents did respond in English. If we are doing a second round of the survey, and we're thinking about potentially including something to get at the issue of the impact of food insecurity on immigrants, although we want to make sure that our survey questions are respectful and do not potentially bring fear or into people who are responding to the survey.
Yeah, and I'll just add, we decided not to ask that because I'll just respond to that too, Katherine, and I think I was on mute, but I think we decided purposefully not to ask that because we really wanted them, as the survey came from the Greater Boston Food Bank, we wanted them to know that all people are welcome at our food pantries regardless of immigration status.
Thank you. So I see one hand in the chat. Stephanie Gibbs, I'm just gonna allow her to ask her question. Stephanie, I'm gonna go ahead. Okay. Stephanie, if you want to still ask a question, maybe drop it into the chat. It seems like the question is not, oh, okay. That was a mistake. Great. We'll close on this last question. Do you have any analysis or data by geographic areas, communities, and regions?
So as of now, our analysis is really statewide, looking at Massachusetts. We do probably have enough data with about 3,000 respondents to look at the county level, but we won't really be looking at geographic areas that are really smaller than the county level, just due to the sample size that we have in this survey.
Thank you. Jonathan, do you want to speak quickly to the resources you dropped in the chat?
Absolutely. So as Katherine Drennan-Lid mentioned, there are a couple of resources that we routinely recommend and encourage individuals, families to utilize themselves, as well as providers to share out with those that they're serving. GBFB.org/needfood is sort of an interactive page on our website that you can enter your town or zip code in to find local resources, addresses, hours of operation, any notes about the distribution, and then a phone number to call ahead and make sure you understand the COVID era rules and practices. You can also call the Project Bread food source hotline. I put the link there. And then mass211.org. Again, we talked a little bit about the whole breadth of resources that individuals and families should be taking advantage of. A resource like Mass211 is not just food specific. So a caller or a service provider can really get a large number of resources that might be appropriate for any one situation going through Mass211. And then as we noted, families with children had higher prevalencies throughout as we looked at the data. So there's a website there, mealsforkids.org, and families and again, providers can find summer meal sites as we're getting into the warmer months to ensure that those children have access to food through the summer months.
Well, thank you all. And with that, I think we're going to close it out, and I'm going to turn it to Danielle to close us out.
Thank you, Katherine. This concludes our presentation on the gaps of food access in Massachusetts during COVID-19 report. If you have any additional questions or would like to learn more about the Greater Boston Food Bank, please visit gbfb.org/data or email the data team at data@gbfb.org. We hope you will walk away from this presentation with a greater understanding of the state of food insecurity and the gaps to food access in Massachusetts, and that you are inspired to share this research or have a dialogue on how to utilize this work to take action. Our goal is that together we can work to close these gaps to accessing food assistance, and that this research will inform our collective mission to end hunger here in Massachusetts. Thank you.